Locals living in the shadow of Mount Etna face the task of cleaning up volcanic ash and dealing with hidden health costs. Is Sicily finally seeking a solution? When Emilia Privitera began coughing incessantly in March 2021, she initially worried she might have contracted COVID-19 again. When her test came back negative, she thought it might just be seasonal allergies. But the cough persisted for weeks, and my lungs made a strange wheezing sound when I inhaled between coughs, she told Euronews Earth. So I went to a specialist, and they discovered something I never expected. Tiny, almost invisible ash particles lodged in my lungs. Privitera lives in Nicolosi, a town near Catania, Sicily's second-largest city. The town sits on the slopes of Mount Etna, Europe's highest and most active volcano. Whenever an eruption occurs, which can happen several times a year, her symptoms flare up, a plight shared by hundreds of other local residents. In recent weeks, a series of powerful eruptions has thrust Mount Etna back into the international spotlight, both for its fiery displays and for causing hundreds of flight delays over the course of a week. Yet, while millions marvel at this natural phenomenon, far less attention is paid to the people living with the consequences of the volcano's constant ash emissions. During periods of intense volcanic activity, ashfall can reach thousands of tons per day, blanketing towns across the region. Volcanic ash consists of microscopic particles of rock, minerals, and volcanic glass. It can easily accumulate on rooftops, in building crevices, and in hard-to-reach street corners, remaining there for years. This ash can act as a mineral-rich fertilizer, improving soil drainage and water retention in the surrounding land. However, these particles also pose hidden health risks, particularly when inhaled after being stirred up by wind or vehicles on ash-covered roads. A 2013 study on the 2002 eruption of Mount Etna, one of the most powerful in recent times, found a significant increase in emergency room visits for acute respiratory illnesses. Cardiovascular conditions, and eye irritation during the eruption compared to the same period the previous year. The University of Palermo has also previously conducted studies investigating rising thyroid cancer rates among populations living in the Mount Etna region, alongside evidence of increased exposure to trace elements associated with volcanic emissions. During the eruption of Mount Etna in early August, Sicily's Civil Protection Department, which handles disaster prediction, prevention, and emergency management, reported a rise in the number of patients rushing to hospital emergency rooms in the province of Catania. They presented similar symptoms: eye irritation or conjunctivitis, coughing, runny or stuffy noses, and sneezing. Crimi stated that he observed an 8% increase in medical visits compared to normal levels.
Sì, poi ha ripreso.